Hey, deserving listeners, it's time for me to continue watching John Oliver and reacting to them talking about mental health care. My name is Dr. Kirk Honda. I'm a therapist and professor. Let's watch.
And that shortage speaks to a mental health care system that is so dysfunctional, it seems almost designed to prevent patients from accessing it or providers from entering the field. And a lot of that comes down to how we pay for care. Therapy isn't cheap. The typical fee for a session with a clinical social worker is between $120 and $180.
Yeah, 120 to 180. I have supervisees that charge 250, 300. For a lot of people in private practice, they don't want to take insurance anymore because insurance will impose a lot of lower rates. You know, so say your fee is 180 and you use insurance, well, the insurance will force you by contract to lower it to 80 or even $70 or something. And to you, that might sound like, well, $70 an hour, I mean, that's doing pretty good. Well, you got to pay for rent, you got your taxes, you have to pay for your student loans. Like $70 an hour actually as a therapist, and especially if you're seeing maybe 20 clients a week because the other time you're doing paperwork and other kinds of things, it might sound like, whoa, that's a lot of money. Why are they charging so much? Therapists aren't rolling in cash usually. Even people who charge $250 an hour, they're not in big mansions.
Dollars in major cities, and the going rate to see a psychologist can be as much as $300. And the thing is,
especially when you live in Seattle and the average house is something like $900,000 or something. I don't know. What is the median? Yeah, I wasn't that far off. The median house in Seattle is $850,000. $70 an hour, I don't think it would pay for that.
Have laws that are supposed to make treatment both affordable and accessible. In 2008, Congress passed a law mandating mental health parity. Basically, that big insurance plans must cover mental health care at the same level as all other care.
Yeah, and we fought for this back then and won, which felt like a huge success, but the fact is that it's not regulated enough. The government passed this act, but they have to actually do something about it. You know, it's like I learned this when I was in my 20s, early 20s, and someone hit my car. I was just parked in a parking spot and they just hit me, knocked my whole back fender off. He said he would pay me the money to repair it because it was his fault, obviously. But when I called him later, he was convinced by his wife or something that it wasn't really his fault. And I'm like, how is it not your fault? I was parked and you hit me. I took him to small claims court and the judge said, yep, he was at fault and he has to pay $400 so that I can get a new bumper. In reality, I just duct taped the thing on and thought, well, I could use that $400 to pay for rent at the time when I was 19 years old or however old I was. I won and I thought, yay, I now have $400. No, because he doesn't have to pay me. He could just not pay me. And I'm like, well, what am I supposed to do? And this is before the internet, so I don't know who to ask. Well, someone tells me, well, you have to go back to court to force him to pay. But I'm like, but the court said he has to pay. Like, I have to go back? Like, what's the deal here? So the point is that the government can say, do something, but unless you follow up with consequences if they don't do those things or they don't do it enough, then it's worthless, which is what happened.
The reality of this system can be starkly different, starting with simply finding a provider who takes your insurance.
I kept telling my mother I wanted to see a therapist. Then it's finding a therapist, and it's finding a therapist that takes your insurance.
To find a children's therapist that is covered under your insurance, it was mayhem.
Yeah, I mean, there are particular specialties that are virtually impossible to find a therapist. Now, ironically, if you have very little money, and you qualify, therefore, for state insurance, Medicare, Medicaid, this kind of thing, then you're actually more likely to find a clinician, anecdotally, because those community mental health agencies in the state of Washington are the only places that take those kinds of insurance, are allowed to take that kind of insurance. They tend to have a lot of therapists that are just out of graduate school, interns. They have a whole team of interns that are students at the time. Really good therapists, really eager therapists. It's easier to find a therapist, but if you are working and you don't qualify for medical coupons, for Medicaid, Medicare, then you actually don't qualify. So you have to actually find therapists in the general marketplace, which can be a lot harder sometimes, particularly if you don't have a lot of money. The other thing is that if you're trying to find a specialist like a child specialist, there tends to be certain population groups that therapists like to work with more often than others. There's a lot of therapists that like to work with adults who are suffering from mild problems, or couples that are suffering from mild conflict, this kind of thing. And there are high stress issues like abused children that only some therapists are definitely interested in that for sure, but the rate, anecdotally anyway, is lower. So yeah, it doesn't surprise me that someone's like, I'm looking for a therapist, a child therapist, under my insurance, and there's nobody. Yeah, it's a huge problem. The way that it works is that the landscape of mental health, you have the community mental health agencies, you have group practices, and you have private practice. Private practices are basically the same thing. You just have people that are self-employed therapists. And this is how I was and have been the majority of my career. I'm a self-employed therapist where you have your own office and it's only you. And so what happens is that you will, usually in the beginning of your career, you will contact all the different insurance companies, and there are many, and you apply to be a preferred provider. So you say, hey, Primera Blue Cross here in Washington State, and you say, I would like to be a preferred provider. And then there's an application process, and usually you get turned down because they say they have enough therapists already. They don't need more therapists. And so when someone gets Primera Blue Cross through their work or something, and they go to Primera Blue Cross and they say, okay, I'm looking for a therapist. And, same way that you would say, I'm looking for a dentist, or I'm looking for a heart surgeon or something. You say, I'm looking for a therapist. And they give you a list of preferred providers. These preferred providers are people that have contracted at a certain rate, and Premier Blue Cross will pay for the service if it's medically necessary, and your copay is only, say, $20 because they're within network. For people outside of the United States, you're just like, what is going on? But this is how our system works. And so I, for example, applied to be on the panel or the preferred provider list of Premier Blue Cross, and I was for many years, and I somehow got in. A lot of people apply, they don't get in. But anyway, when you're given that list, they're usually given like the first 5 therapists under that insurance that are closest to their work or their home or something. And if I'm on the list, then the client calls me and they say, do you have opening? And so that list, say of 5 therapists or even 50 therapists, particularly psychiatry, all the preferred providers that are allowed on this insurance program are full. What do you do then? That's a problem, right? And why doesn't the insurance company just add more therapists? All they got to do is put them in their database. It's not hard to do, right? Plus, the customer, the patient looking for a therapist or a psychiatrist, they're paying for insurance, because you're paying monthly hundreds of dollars, and part of that money is supposed to be going towards that database to have of all the different therapists. I mean, presumably, if you pay for health insurance, there are clinicians at the ready to help you, right? But the thing is that insurance companies know, and I can't prove this, but it looks this way to me, that if they shut the door and limit the amount of therapists in their pool of therapists that are available, and they know that only a small percentage have any openings, they know that when their customers call for therapy through their insurance, they will run into roadblock after roadblock, and guess what happens? The patient gives up and no longer wants therapy because they've given up, or they pay for it out of pocket. Well, guess what happens? The profits of the insurance companies skyrocket because you are now paying premiums as a patient, hundreds of dollars a month, and the insurance company is not paying for services for that person. So it's within their interest to limit the amount of therapists that are on their list and to not get rid of the therapists that are full. So just think about that. There's another problem that some insurances like United Healthcare and Cigna, where they reimburse therapists so low that most therapists don't even want to contract with them. This is what I went through. So I used to contract with a lot of different insurance companies like 15 years ago when all I was doing was private practice. And I contracted with Premier Blue Cross. We have Regents Blue Shield in Washington. There's Cigna and other kinds of places. Cigna paid something like a third. In 1 hour, I'm being paid, say, $100 an hour. The next hour, I'm being paid $34 an hour or something. And it's like, I wonder which insurance company I'm going to want to work with, right? So if your employer offers Cigna to you and you're like, well, I guess I have Cigna, and no therapist wants to work with Cigna, then again, you have a problem of a shortage of therapists on that program, or the therapists are maybe not the best therapists because they're business isn't doing so well and they're desperate for clients. And so they will even take those Cigna clients, that kind of thing. So I'm just talking anecdotally, but it's just all part of the weirdness. And I'll tell you, again, if we voted for politicians or pressured our politicians to raise taxes or allocate taxes, this whole thing would go away. You would just have a government program of mental health that paid for everyone to be able to get the service that they wanted at a reasonable reimbursement rate so that everyone gets services. In the same way that every town has a fire station and a police station and every town has roads, we can pay for this. It's available to us. We just have to ask for it and vote for it.
You couldn't find anybody?
I couldn't find anybody.
Blue Shield sent me a list, like, I should be fine. Just make a few phone calls. I'll find somebody. I called everybody on this list.
Yeah, I have seen this exact list. It always looks the same. So many times people will say, what am I supposed to do here? I called everyone on the list. No one called me back. They're all full.
Only one place called me back.
Yeah, if you've listened to my podcast, you know that I will rant about this frequently. I talk with Bob about this sometimes. I learned as a patient myself, as a client myself, that when I would call therapists, most of the time they would never call me back. When you finally decide on a therapist, okay, I think that one might be good. You read about them, okay, I think I might. It's a very vulnerable place, and usually you want someone within a few weeks, a month or something, and you call them, you leave a message, and you're just sitting there, no call back. Do I wait? Do I call back? Is it rude? What are you supposed to do? And as a client, I felt completely powerless. And when you call 5, 10 people and none of them call you back, you're thinking, am I doing something wrong here? Now, if the clinician is full, they should be calling you back and saying, I'm sorry, I'm full. Like, for example, on my answering machine, it says I'm full. When you call it, it says, my practice is full, I'm sorry. There's something wrong with our system or our training or our supervision or our culture as an industry where so many therapists just don't even call you back. Just like, I don't feel like it. And I've talked with clinicians about this and they're just like, oh, well, I'm real busy, or, sometimes it'll be 2 weeks later and I just feel like, well, it just feels like I should have called earlier. So, I just won't call them. I'm like, you're a business and that person could be in crisis. Let them know that you're not available. Just tell them that. This is a patient. This is someone who needs you. Call them back. You're a business, for crying out loud. You know what I mean? Yeah. Drives me nuts. Huge problem. Huge problem. And who do I blame? Where do I direct my anger? Well, I guess I direct it at us as a culture, because there's certain standards and practices that we talk about as a way of trying to emphasize care to people. And this is not one of those topics, but it's the first problem that people run into. I mean, you ask any client out there that look for a therapist, and in all likelihood, they ran into this. And it's disgraceful. It's embarrassing. And guess who suffers? The client. They're already suffering. And we as an industry are causing them to suffer even more because we're too irresponsible to call people back. I mean, just ridiculous.
Distressing for a number of reasons, not least of which is it forces someone into the appalling position of actually wanting to be called back on the phone, which is just horrifying. The best phone call is a text. The second best is an email, and the third best phone call is 2 traded voicemails. Everything else is a complete nightmare.
Yeah, funny. And I will say that anecdotally, if you can email the therapist, you're probably more likely to get a response because it's easier to respond quickly.
Now, some seeking care have even run up against what are known as ghost networks. That's lists from insurance providers that are padded with clinicians who either don't take new patients or are no longer in network.
Right, so this is what I was referring to earlier. If the insurance company allows for this to happen over time, and I suspect they know what's happening because the insurance companies are very interested in a lot of data and there are a lot of complaints, but if they pad their preferred provider list with clinicians who are full or are no longer in the coverage network, then they can advertise, look at all of our therapists. We have 2,000 therapists that are preferred providers, so come one, come all. And then your business signs up with that insurance company, and then your employees start looking for therapists. they can't find any. And the thing is when you're a client and you can't find a therapist, typically the client blames themselves. They're just like, well, I must not be calling the right person, or I don't know, maybe I'm just being a crybaby and I don't need any help. Like, it's not typical that a client will be like, wait a second here, hey, insurance, knock it off, because there's so much stigma around mental health as well. And so sometimes people don't even want to, call out like, hey, imagine if there weren't enough regular physicians, right? Like family physicians, just people who do regular checkups. Like, you called your insurance company and there was no physicians available. Well, that doesn't typically happen. Why? Because they know they can't get away with that. They know they can get away with not providing enough mental health services because I think they count on stigma to keep the clients silent, which is just awful. But of course, when we have a system that is based on capitalism, that's our mental health and healthcare system. It is a capitalistic system like Coca-Cola or Facebook, then this is what you get.
Numbers for a McDonald's, a boutique, and a jewelry store. Although, to be fair, if you're a woman...
Wow, so I think what they're saying is that it's possible that this insurance company was actually falsifying their records and saying, so-and-so psychiatrist is available, here's their number, and they were just inventing people. When you have capitalists running our mental health system and a government that looks the other way, this is what you get.
Anthem's network for years when she worked for a large medical group. But when she started a solo practice, Anthem refused to contract with her, saying the area was saturated, even though she was one of only 3 psychologists in the county. And when she examined their directory, she found a great number of their providers were no longer practicing or were dead.
Right, exactly. So this is what I was talking about earlier. And that's a pretty stark example of this, that the insurance, again, we don't know, but John Oliver is saying it kind of looks deliberate, meaning that the insurance companies are purposely limiting the amount of preferred providers, which essentially, just so people that don't understand, people that don't live in the States, if you can't find a preferred provider that takes your insurance, then you can't get the service unless you're very, very rich. So if you're just a regular person with a regular job, which is most people, the only way you can get a service is if you go through your insurance, because your insurance will allow you to only have to pay a copay, for example. And so they know that if they limit the amount of clinicians, my dog is barking, then you will no longer be able to get service and the insurance company doesn't have to pay for it.
They sent me an email saying he's approved.
But after checking him in, Anthem came back and decided the treatment was not medically necessary. With insurance refusing to pay, Leah made the financially crushing decision to let her son stay and finish treatment. 85 days in all, and $88,000 of her own money.
Yeah, this happens all the time. It's happened to me. For example, with United Healthcare here in Washington State, this exact thing would happen to me over and over and over again. A client would come to me and say, I have United and I would like to hire you as my therapist. And I'd say, okay. I would contact United and they would say you need pre-approval, which is kind of weird, but okay. Some insurance companies make you jump through that hoop. And I say, okay. So I jump through those hoops. I diagnose the client. I make sure it's medically necessary. I recommend a treatment protocol. That's the standard of care. I provide the treatment plan to United Healthcare. Anthem, I think, is similar to that. And then they send a letter back saying it's approved for 10 sessions or something. I'm always like, ugh. And they, you can be reapproved for more sessions after that time, because usually it was necessary for a lot more than 10 sessions. I'll just put it that way. So then I proceed with services, and at some point during my billing situation, and it's just me by myself just doing everything, and so I send a claim to United, and I wait, like all insurance situations, for maybe 3 months, 4 months, 5 months later to get a response. Now, meanwhile, I'm seeing the client, I'm continuing to assume I'm going to get more approvals, right? Anyway, so 5 months later, I get a response saying, we're not going to pay. And then I'm like, what? So I have to send another letter. Here's the approval. You said it was okay. Why aren't you paying? Well, we determined later it wasn't medically necessary. What do you mean? Because I went through the pre-approval process. What's that? So the first 5 times this happened, I thought, maybe I'm not doing something right. So if you're a McDonald's franchise owner and you have to provide insurance for your employees and you're looking at all the programs and you're thinking, what do I want to pay for? Well, United comes along and says, ours is half the price as the other ones. And they're like, okay, good. That'll be good. Do you have all the things that all the other? Yeah, we do all the things. We have mental health care. We have medical care. We have, all these. It's good. It's great. So they get the business to sign up everyone for premiums, and all the money starts, going towards the insurance company. And the insurance company is behind the scenes, probably talking off the record and saying, okay, here is how we're going to reduce costs and improve our profits. And one of the things we're going to do is we're going to do this BS, which happened so often to me and consistently with United Healthcare here in Seattle, which is notorious for doing this. And I had to learn the hard way. Now everyone knows about United, and I don't even know if they exist anymore. But anyway, fast forward 7-8 years, eventually if someone came to me and they said they had United, I said, I'm not going to work with you. And just so you know, your insurance is terrible. This happens all the time. And I want to say again, that when you have a government that is anti-regulation and you have a voting public that does not vote and pressure politicians to pass laws so that this kind of thing could never happen again, then this is what you get.
Now, that is obviously infuriating. While the company did eventually agree to pay some of that bill, just imagine an insurance company reversing their decision in the middle of any other serious treatment. Hey, we love how this heart surgery is going, just popping in to say it's done.
Well, to be fair, that does happen in medical procedures. It doesn't maybe happen as often, I don't know, but it happens because insurance companies are about profit. They're not necessarily about patient care.
Had an average denial rate of 92% when it came to doctors' requests for coverage. And yet, according to one of Anthem's medical directors at the time, there was a good reason their system operated that way.
Doctors will spin the clinical information. They will make things appear more serious than perhaps they are.
This is both infuriating and also kind of true. So on one level, yes, absolutely. As I've been saying, these insurance companies are about profit. And so any kind of cost savings that they can get away with, they'll get away with. If we as a nation, as a government, as a country of laws allows this to happen, if we don't regulate it, then they're going to do it. In the same way that the housing crisis happened in 2008 because there weren't any regulations on speculative investing, you're just going to get this kind of thing. You need government oversight. You need someone saying, whoa, 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 you can't do that. So on some level, yes, that's absolutely happening. On another level, it is true. I don't know about physicians because I don't work in that industry, but I do know in mental health, some clinicians, it's rare, but it does happen, will actually lie, fraudulently apply diagnoses that aren't actually present. So someone comes into therapy and they don't qualify for any medically necessary diagnoses. And the therapist is like, well, but I really want to work with this person and they really want therapy. So what do I do? Well, I'll just make up something. I'll just make up a diagnosis, I'll put it on the claim, and I'll send it in. So there is truth to that. It does happen. I don't know the rate of it happening. It's pretty rare, but it does happen. So it is true that insurance companies are in the right, so to speak, to push back on that and say, hey, you got to justify this. But it's really hard for the insurance company, right? Because that would be a lot of labor. They would essentially themselves have to evaluate the client, which would be really hard to do and would be a waste of money. So they take shortcuts and they just kind of deny a lot of services, figuring, well, they're probably catching some people that are don't actually have diagnoses, that kind of thing. But I want to be clear that in an ideal world, one that could exist in our country, we wouldn't even necessarily need a medically necessary diagnosis because a lot of conditions and issues related to therapy don't have anything to do with a medically necessary diagnosis. Medically necessary diagnoses like major depression, bipolar, schizophrenia, these kinds of things, PTSD. So some of human suffering are encompassed in the DSM. A lot of human suffering that will absolutely benefit from therapy don't have a clinical label for it, or at least not in the DSM. Things like insecure attachment or relational conflicts, these kinds of things. Now, traditionally, we don't see those things as mental illnesses, right? We're like, well, those aren't mental illnesses. We don't need to allocate funds for that, right? Because it's just like elective services, that kind of thing. And okay, we could talk about that line, but in an ideal world, which could exist, is that we would have enough funds paid for by the government, raising taxes, that could pay for everyone to get therapy, even when it's quote unquote not medically necessary, which would be a much better world. You would be able to reduce conflict, divorce, drug abuse, parenting problems, kids that are raised in homes that have therapists that don't have therapy to help them with their issues, with their traumas, relational traumas. We live in a much better world, perhaps a world that was more safe. The economy would be better because people would be working more, because they wouldn't be suffering. You know, if we want to look at those kind of dollars and cents issues, it would be a good investment.
Now, I know treating critical healthcare as something doctors have to win may seem dangerous, but that man will have you know, it isn't.
I can not offhand think of a situation where a decision was made to discharge a patient from a hospital and some terrible consequence occurred.
That's absurd. I mean, if he can't think of a story, that's fine, but research shows it happens all the time. The other thing I'll say is that some insurance companies are great. For example, I mentioned earlier Premera Blue Cross. I'm not sponsored by them or anything, but I was paneled by them for 20 plus years. And I would send claim after claim after claim. They never questioned anything because they trusted their clinicians that were paneled. So whereas if I was working with Cigna or United Healthcare or something, there would be roadblock after roadblock. So it's not all insurance companies. Now, another thing I should point out is that Premera Blue Cross charges a lot more money to their people, to their customers. So as a customer, if you want to have Premera Blue Cross, you have to pay double or triple the monthly fees to have that than these other kinds of insurances. And so thus Premera Blue Cross can still make profits because of that and provide all the services that people want. So it's not universal that everything is a problem, every insurance company is a problem, or every business is a problem, which comes down to a moral choice, right? If as a business, and this guy could easily do this, say, well, okay, fine. In order for us to make profit, we have to cut some corners, but we have a moral and ethical responsibility to not cut as many corners as we could legally. And so we should not do that. Some companies will make that choice and some companies will not. And that's why we need regulations to deal with these kinds of people.
His parents drove cross country to another state and days later committed suicide. Keeping that individual in the hospital longer is not likely to have made any difference.
I would have to imagine that the parents would say if you'd kept him in the hospital, he wouldn't have been in another state killing himself.
Yeah, I mean, that's the point of hospitalization, pal. Like, and again, this isn't just some Yahoo off the street. This is the CEO, I think, of an insurance company. He knows better. So I just love this story because I love it when arrogant idiots tell a story thinking that's proving their point that actually proves the opposite because they're just so dumb or so indoctrinated or so used to everyone saying yes around them or something. But anyway, so if you didn't catch it, he's telling his story about, well, I can't really think of any story where something bad happened. And then he's like, well, I can tell you stories. And he's like, oh, well, yeah, I did hear one story and let me tell you that. And he thinks it's going to be a zinger. It's going to help him win the case, you know, this insurance guy. He says, you know, it was a family brought in their kid to the hospital. The kid was discharged. He left out the part that the insurance company forced the discharge because they said we're no longer going to pay for it anymore, even though the doctors were probably saying, please allow us to treat this kid some more because there's still a problem. They bring the kid home and the kid runs away and kills himself. And who knows the circumstances, but that's why we have hospitalization, so that those kinds of things can't happen. And you would only discharge them when those risks have been mitigated to a certain point. He thinks this is like, well, he was going to kill himself anyway. I think that's his attitude, which is just not what the science says. What the science says is that if you can get people through the difficult time of suicidal intention and you treat them effectively, they will emerge. And sometimes it's just like a week, maybe sometimes just a few days, sometimes just a few hours, but it's not long. It's not like years or months usually. Then when you discharge them, their risk of suicide drops significantly. Anyway, the interviewer's like, Well, I think the parents would say that if you hadn't kicked the kid out of the hospital, the kid would still be alive today. I think that's what the parents would say. And I would say the same thing. I mean, obviously, I don't know the case, but yeah.
Federal and state agencies have responsibility for this, but the truth is, they rarely penalise plans. The Labour Department, which oversees most workplace plans, closed just 74 investigations last year, finding violations in only 12. As for state-level enforcement, a study found that they've levied fines just 13 times since 2017.
Yeah, I'm so glad that John Oliver is talking about this. I mean, even to point out that the regulating bodies are supposed to be doing something, but they're not. And again, it's not because they don't want to, it's because we don't fund them. Because you have Congress people who are trying to lower the government, they're trying to shrink the government, they're trying to lower taxes or spend taxes on the military only or God knows what, and they will not allocate funds for this. If we allocated more funds to these regulating bodies and said, you have permission, go for it, then they would. But their hands are tied because they don't have the funds or the people or the time. So we can blame the regulating bodies, but in all likelihood, they're just underfunded. All right, well, that does it for that episode. Everyone out there, please take care of yourself because you deserve it. You really, really do.